thank you once again for the invite. It is an honour to be asked. I've been given quite an open brief, so I thought I'd touch on some historical aspects of orthopaedics in Wales and give a very brief summary of where we currently are. Now, as Amit's already alluded to, I'm a very fiercely proud Welshman. And anyone who's Welsh is a little bit prone to romanticism. They swing between pessimism and optimism. We've got a little bit of militancy about us now and against, and anything we have a passion for, we're definitely biased, which for me, that includes orthopaedics. And of course, orthopaedics is inherently Welsh. And without certain Welsh individuals, we certainly wouldn't have our speciality. But what sort of state are we currently in terms of orthopaedics in Wales? Well, to be quite honest, it's dire overall. As we all doubt know, the surgical specialities in general have been adversely affected more than any other, and orthopaedics has been disproportionately affected more than any other surgical specialty. And orthopaedics in Wales, I think, has been more disproportionately affected than any other nations in the UK. Now, politicians would have us believe this is all due to the COVID effect, but we know in Wales that it isn't. It's just simply exposed our services and revealed how fragile they were pre-pandemic. We can't return elective and trauma capacity in the post-COVID era if it wasn't really there in the first place. But we're going to save the doom and gloom and pessimism for a bit later on, and we're going to touch on some history and some romanticism. Now, I'm sure many of you will know the story of the Anglesey bone setters, and if you don't, it's not my intention to go over it all today, but there's a very good article by Mel Jones on the Welsh Orthopaedic Society website, which I would draw your attention to. And the orthopaedic dynasty, as it were, really starts with this man, who is Hugh Owen Thomas, designer of the Thomas splint. And he was basically a non-stop kind of guy. He would work every hour of the waking day. He'd very rarely take any holidays throughout his entire career, and he was always working. Now, the other reason Hugh Owen Thomas is important, apart from the design of the Thomas splint, is, of course, his nephew, who was Sir Robert Jones, who was orphaned at the age of 13 years old. And Hugh Owen Thomas became his guardian, and Sir Robert Jones then followed in his practice. Now, Sir Robert Jones probably made the Thomas splint more famous than Hugh Owen Thomas ever had by its use in the Great War, and a significant reduction in mortality rates as a result. And he, of course, is almost famous, also famous along with Dame Agnes Hunt for the institution that bears his name, which is the Robert Jones and Agnes Hunt Hospital in Oswestry. And it's from this place, realistically, that the rest of the orthopaedic dynasty flows. And the first interesting chap on the way is this chap, is Sir John Lynn Thomas. Now, Sir John Lynn Thomas was originally from not far from where I live. He's from Ceredigion, which is Cardiganshire. And it is said that most people from Cardiganshire are a little bit tight. They're careful with their money, and I suspect that this man was no exception. Now, he worked alongside Sir Robert Jones during the Great War and also helped to establish the Cardiff Royal Infirmary as a centre of excellence. His description as an individual is very interesting. He was described as being of above average height, of a very stocky build with a large unruly head of hair, but it's his personality that is perhaps most interesting, that he was said to have a friendly, childlike disposition, but at the same time, he was very combative and transparently interested in his own affairs, which makes me wonder whether he's the very model of a modern day arthroplasty surgeon. And he was also helped establish the Welsh National School of Medicine and to establish within Howell House, which is pictured here, the hospital for limbless sailors and soldiers, which is a very cheerful name. Which was subsequently renamed the Prince of Wales Hospital, and eventually moved to its site in Rhydlafar, finally opening in 1953. Now, the next name in our orthopaedic dynasty is Dillwyn Evans, and Dillwyn Evans' work on foot deformity made him world-renowned, but he was also very well recognised as a very prolific and gifted teacher, sat as the chair of the medical board of Welsh National School of Medicine for many years, and as president of the Medical Student Society on 3 separate occasions. Such was his popularity with the medical students overall, due to his commitment to teaching. The next notable individual to mention is Rowland Hughes. He was the first sole appointment to the Robert Jones and Agnes Hunt, and was again a renowned teacher. And it was him that was responsible for instituting the famous Friday afternoon clinical conference sessions, followed, of course, by the evening meal in the doctor's mess and the usual game of Oswald Street billiards. And another person to mention in this story is Professor Bob Owen, who I was honoured enough to meet in his time. Even at the age of 95, he was still coming to Welsh Orthopaedic Society meetings and engaging with trainees and his consultant colleagues at that point. And it was an honour to have met him and have known him. And Professor Owen was himself very responsible for the introduction of the Charnley implant in the first centre outside of Wrightington, due to his close association and indeed friendship with Sir John Charnley. And it was the ideals of these 3 individuals and the ethos that they helped set up in terms of Welsh orthopaedic surgery that led to the formation of the Welsh Orthopaedic Society, which was very ably assisted by David Jones, previously at Ysbyty Gwynedd, and now and also in Great Ormond Street as well. So after this fantastic start, where did it all go wrong? Now, as you might have gathered, we're about to move into the doom and gloom pessimistic session at this stage. Well, why am I showing you a picture of a roundabout? Well, this is the site of the previous Prince of Wales Hospital, which after 45 years of service was closed in 1998. And it would be probably disingenuous to suggest that the closure of the Prince of Wales was the reason why we're in such problems now, but it's a symptom of what else was happening in Wales at that time. If you look at these numbers in terms of bed numbers for Wales, this is the entire NHS, over the last 30 years, bed numbers have been cut in half. And the biggest reduction in those bed numbers happened in those first 10 years between 1990 and the year 2000. And in 2003, the Welsh Government prepared this document and published it, called an Orthopaedic Plan for Wales, within which they demonstrated that the population was changing, our population was increasing, and the demographic of that population was also changing, with an increase in the number of 65 to 74-year-olds predicted. And they also demonstrated that within Wales, we weren't offering the same proportion of surgical intervention to people. We were under-offering surgery, and that if we corrected that by 2012, there would be a significant increase, somewhere around 30–40% in terms of the number of operations we would need to provide. And within that same document, they predicted a shortfall in number of trauma and orthopaedic beds by over 170 by 2014. The Welsh Audit Office then in 2005 kind of backed up those findings and went even further. They said, there's no clear overall strategy. We don't have protective elective capacity, which would help us get on top of the waiting list. And the biggest reason for cancellation of an orthopaedic operation was an unavailable ward bed. And at the end of the day, no management of the waiting list issue had managed to provide a sustainable reduction in waiting time. So we had a perfect storm of increasing activity, reduced resources, and a much, much greater demand. Yet, surprisingly, as these figures show, there wasn't much of a huge effect. There was a fairly modest increase in the number of patients waiting for inpatient and day case treatment, and a slightly larger increase in patients waiting their first outpatient appointment. And of course, the reason for this was that we were using waiting list initiatives, which are simply another version of Aneurin Bevan stuffing their mouths with gold. And the Welsh Audit Office highlighted this in their report, saying that they've been widely used, but they didn't deliver sustainable reductions in waiting times, questionable value for money. They help out the patient who's having their treatment under that waiting list initiative, but they do nothing for the patient of the future. And most importantly, the control of the expenditure on waiting list initiatives had been very, very poor. So we had these two documents published, both of which were very critical of our current, of the system as it was at that point. And you would have thought then that there would be a fairly rapid pace of change, bearing in mind these two documents. But sadly, it was anything but. Welsh Audit Office published again in 2015, in which they highlighted, and this is from their document, there was 7 years of complete inaction following the publication of the Welsh Government Plan. Literally nothing happened, nothing changed. And then in 2011, the National Orthopaedic Programme was put in place. Now, the National Orthopaedic Board met quite a lot in 2012, 2013, but apparently didn't meet at all in 2014. So by the time the Welsh Audit Office published in 2015, they were pretty critical of that project as a whole. They stated that only 2 out of 15 of their priority actions had been achieved. And one of the main reasons they gave was a lack of engagement with senior clinicians in health boards and senior clinicians in executive roles as well. One action that the National Orthopaedic Board did manage to get through, though, was the commencement of a musculoskeletal assessment and treatment service, which is known as CMATS in Wales. In 2014, the National Board was then replaced by the Welsh Orthopaedic Board, which is part of the Planned Care programme. And since then, the board has been meeting over the years with very much an agenda driven from central government rather than a clinically led agenda, I would say. So despite the Welsh Audit Office, every man and his dog explaining the futility of waiting list initiatives as a reasonable measure to address the issue, the money kept on being ploughed in. The money was never available for sustainable solutions. And in 2013, I think it was, they provided 65 million over a 3-year period to address the waiting list, but only provided 4 million of that to be able to spend on a capital project that would provide a sustainable long-term solution. Now, it's very, very difficult to gauge how much has been spent over the years, but it's probably close on to 500,000, I would say. 500 million, certainly between 400 and 500 million. And so by the time the Welsh Audit Office published their report in 2015, unsurprisingly, they felt we weren't well placed to manage. Now, GP referrals kept on increasing, and the particular uptick around about the time of CMATs coming into play. We had prudent healthcare, which was rationing by any other name, which was pretty radically applied to orthopaedics, and we had the Getting It Right First Time report, which was completely ignored by health boards and Welsh Government to a man. And since 2015, we've been in some sort of Groundhog Day, with more money being spent on waiting list initiatives, bed closures of the winter crises, and not able to make any impact to provide better care for our patients. And then along came COVID, and basically our service was wiped out. Like everywhere else in the UK, we went into hibernation in terms of orthopaedic practice for about 6 months. We had a very brief Indian summer at the end of last year, and we started back again in April of this year with only about 30% activity. But starting back, we've lost staff, we've lost clinical areas, we've lost theatre capacity. Some pathways of care have just completely disappeared for us. And the outpatient waits have increased, not by as much as you would expect maybe, but the proportion of patients waiting more than 36 weeks has increased by over 13,000. And of course, only a small increase in patients waiting inpatient treatment, but all of those outpatients are going to convert. But we're going to go back into a bit of optimism now, because our response as orthopaedic surgeons throughout Wales, and I'm guessing throughout the UK as well, has not gone unrecognised. We've gone from being fully paid up members of the awkward squad and always complaining to actually being clinically engaged with our managers and with Welsh Government centrally. We've rolled up our sleeves, we've learned new skills, we've looked after patients on critical care on the wards, we've been proning, we know how to give CPAP, all of these things, and that has gained us some significant traction. The Welsh Orthopaedic Society has also been very, very active, more clinical engagement with Dr. Andrew Goodall for the NHS Wales, and also a new regional approach to how we're going to provide orthopaedic surgery in the future. But what does the future look like? Well, we might need several of these. We might need several of these. I don't think only one of these will do, but certainly we're going to need lots of these if we're going to recover and get out of the dire situation that we're in.